All right, we're going to go ahead and get this party started. So good afternoon, and thank you for joining us for today's event. My name is Mike Burns. I'm the president of the board of directors for Maternal and Family Health Services, and I'm thrilled to join all of you here this afternoon to celebrate this amazing new facility. Thank you to the Honorable Matt Cartwright for his role in making quality healthcare more accessible to the people of Lackawanna County. The facility we stand in today would not have been possible without a strong partnership of public and private funding. When local, state, and federal governments come together with private foundations and in-kind donations, look at what can be accomplished. Innovative, groundbreaking healthcare delivery right here in our community. On behalf of the women and families that we serve, MFHS would like to offer our most sincere thanks to the Harry and Jeanette Weinberg Foundation, the All One Foundation, the Highmark Foundation, Benco Dental, PNC Bank, the City of Scranton Department of Economic and Community Development, the Pennsylvania Department of Health, PA WIC, USDA, and Representative Kyle Donahue. Most notably, this project would not have come to fruition without the support of Congressman Cartwright and his critical leadership in securing a $2.15 million congressionally directed appropriation through the Administration for Children and Families. Since 2013, Congressman Cartwright has been a champion for the people of northeastern Pennsylvania and is focused on bringing federal funding home in order to improve our community. His priorities include strengthening the middle class, creating jobs, ensuring quality health care, protecting seniors, and supporting veterans and military families. He is a senior member of the House Committee on Appropriations and serves as a ranking member of the Commerce, Justice, and Science Subcommittee, and he is the second highest Democrat on the Financial Services and General Government Appropriations Subcommittee. The Congressman continues his commitment to improving the quality of healthcare in Lackawanna County with this $2.15 million investment in MFHS. This funding is instrumental in creating the first maternity medical home model of care in Pennsylvania, allowing for pregnant and parenting persons to have a seamless healthcare experience, keeping them from falling through the cracks because of unreliable transportation, high copays, or any of the other barriers that impact so many in our community. Today it is our great honor to present Congressman Matt Cartwright the MFHS Distinguished Public Service Award. The award recognizes a public servant who has demonstrated leadership in improving health equity in Pennsylvania and has exemplified the MFHS mission of meeting the healthcare needs of our community through quality care. Congressman, thank you for your dedication to the women, children, and families that MFHS serves. On behalf of all of us at Maternal and Family Health Services, I am pleased to present you with the Distinguished Public Service Award. Would you like to say a few words? Thank you, Congressman.
I don't have to fit those balloons in my car, do I? Good afternoon to everyone, and thank you to Mike Burns for your kind words, and thank you to Maternal and Family Health Services for honoring me with your Distinguished Public Service Award. I see so many longtime friends here and people who I know love working together for the betterment of our community, people who I've been friends with, for 20 and 30 years. It's not a surprise that people of this caliber show up to events like this. Folks, health equity in northeastern Pennsylvania is a top priority, and I will continue to fight for high quality, affordable Medicare for all medical care for all Americans. As a senior member of the House Appropriations Committee and as Mike said, ranking member of Commerce, Justice, and Science, I'm doing what people around here want me to do, scrap every day down in DC to bring home our region's fair share of federal tax dollars. It took me long enough to get to be one of the top appropriators in Congress, and it's kind of fun, Bob, because people read my letters now. It's kind of nice. The $2.1 million I brought home for the Circle of Care program will ensure at-risk and low-income pregnant women have access to quality pre- and postnatal care, along with critical wraparound support services. I just got a terrific tour bringing to life those words. and I thank you for the tour. I appreciate that. A wonderful building designed by a phenomenal architect, Michelle Dempsey over there, and preserving not only so much natural light in here, but also part of the original framework of the silk mill that was here. Silk mills are, people forget, but are such an integral part of our region's history. Every year at Labor Day, we gather at the John Mitchell statue to honor really the seedlings of the labor movement in America right here. And I love to read the closing argument in the coal mine strike of 1902 and 1903 of the lawyer for the United Mine Workers, a hero of mine, and particularly a hero of my wife Marion Munley's, Clarence Darrow, who at the time was the best trial lawyer in the United States. But he was 24 years old. It was one of his very first trials handling that thing. And I love the quote. Online, you can pull up his closing argument that was transcribed. And the words that tumbled out of that 24-year-old lawyer's mouth, you can't believe. And I love to quote that, sometimes at length, in bad weather, out in front of that statue on Labor Day. But one of the parts that I discovered was it wasn't just the mine workers, who were all men, right? 7,000 men that went out on strike. He wasn't just talking about them in his closing argument. He also talked about why the men had to go out on strike, because they weren't paid enough. And you know how they weren't paid enough? Because their daughters had to go work in the silk mills. And so Clarence Darrow wasn't just fighting for the men in the coal mines, he was fighting for the girls in the silk mills. I'm not saying that Michelle, I'm not saying that this employed underage girls in this particular building, but it's something that this kind of architecture puts me in mind of. Congratulations on a wonderful rendering of a fantastic building, Michelle. Hats off to you. The tour I got showed me a program of pre- and postnatal care that is phenomenal. The program aims to promote self-sufficiency, reduce poverty, and promote healthy development and greater well-being of women, children, and families. Circle of Care is unique in that it will offer a maternity medical home model approach that provides comprehensive maternity care for the most vulnerable in our community. And you might be asking yourself, what is a maternity medical home? Well, basically, it's one-stop shopping, where new moms and soon-to-be moms can get all of their medical and mental health needs met under the same roof. In addition to much needed comprehensive medical care, this funding will ensure a level of dignity that is too often missing in healthcare services for low-income communities. This is a warm and welcoming building that will be a place that patients will be proud to go to. When pregnant women come through these doors, they'll know that they matter. They'll know that they are valued. This facility will also provide good-paying jobs, drive local economic growth, improve the quality of life for our surrounding community. And these funds will go toward hiring certified registered nurse practitioners, registered nurses, medical assistants, peer navigators, and more. They will also be used to grow and further educate hired healthcare workers with additional training and preparation. Today's grand opening of Circle of Care, made possible by the support of donors in addition to federal, state, and local government funds, serves as proof that when we all work together, as we have here, we can effectively address the needs of our community and better the lives of everybody in it. Thank you so much for this kind award, and and I'm very confident that this is money that will indeed be well spent. Thank you so much.
Thank you very much, Congressman Cartwright. MFHS is also very grateful to the Harry and Jeanette Weinberg Foundation for its long-term support of MFHS and its most recent investment in our mission, $1 million in support of this Circle of Care facility. Bob Kelly serves as trustee and former chair of the board for the foundation. Bob, would you like to come up and say a few words?
Good afternoon to all who are assembled here today. Thank you for those remarks, Congressman Cartwright. So first and foremost, on behalf of my fellow trustees of the Baltimore-based Weinberg Foundation, I want to extend our sincere congratulations to Maria, to her entire board of directors, her executive team, all of her staff, but most importantly to the individual patients and clients of MFHS who will be able to receive high-quality care in a setting that imparts dignity and self-respect. Because that matters so much. If I were to walk in here, I would say I'm clearly receiving health care in one of the top providers of health care in northeastern Pennsylvania. Hats off to you. I will tell you, I've driven by this place 1,000 times, mostly going to Alfredo's, and never caught my eye. Never did I look at this place and say, that could be one of the premier spots. And it's vision. I don't have it. She does. She and her team do. So hats off. This was and I saw it when it was down to the studs, and I see it today when it's completed. And Michelle Dempsey, congratulations as well. So beautiful spot. Weinberg Foundation has a relationship goes back more than 15 years when Maria's predecessor, Betty Cox Saxton, first introduced us to the Nurse Family Partnership, which Nicholas Kristof has described as brilliantly effective. And its only sad part is it only affects about 2 to 3% of the people who really need it. Thanks to Congressman Cartwright for his undivided focus on bringing money to northeastern Pennsylvania to truly help the medically underserved. A lot of people talk the walk, he talks, talk the talk, he walks the walk. And for that, we're appreciative, not only for Maternal and Family Health Service, but for the entire network of providers, Scranton Primary, Rural Health, the Wright Center, Children's Service Center, I see Mike Hopkins here today, but all of these organizations that are such an important network of providers would not be able to do it without Congressman Cartwright and the support that he provides. We are not here alone today. John Cosgrove from All One Foundations. I see Danielle Breslin from Moses Taylor Foundation, Lauren Allen from PNC Foundation. At risk of omitting somebody, Laura Duchessi, Scranton Area Community Foundation. This all money came together from a really broad-based community effort, and it continues. One of the wonderful things about philanthropy in northeastern Pennsylvania has developed tremendously over the last decade, that we now have a large number of partners who are working collaboratively to try to put their money into projects that really work. With that, I will wrap it up. Congratulations. If anybody in the room has not done the full tour, you have to see the tour of this place. Every inch of it is unbelievable. Congratulations and best of luck.
Thank you very much, Bob. This project also could not have been realized were it not for our ongoing relationship with PNC Bank. In addition to providing the necessary bridge funding for the project, PNC helped facilitate our efforts to secure an allocation of new market tax credits from the U.S. Department of the Treasury. The bank purchased those tax credits, which resulted in a $1.5 million equity investment into this project. Representing PNC Bank today is Nicole Costanzo, Senior Vice President for Corporate and Institutional Banking.
Good afternoon, and thank you for having us today. On behalf of my PNC colleagues here in Scranton and across Northeast PA, it's a pleasure to be here and a thrill to see the new center officially open. PNC's financing support for maternal and family health services in the form of a $3 million bridge loan and 2.4 of new market tax credit equity reflects our support for and commitment to advancing the welfare and economic health of our community. This project brought together the range of capabilities that PNC can deliver locally by leveraging the strength of our standing as a national Main Street bank. Equally as important, this new facility is a reflection of the terrific, long-standing relationship that PNC and Maternal and Family Health Services enjoy. Of course, it's also a shining example of the shared focus that we have on caring for our community. What could be more essential to the future of our success of our hometown than ensuring that parents and their children, our leaders of tomorrow, have access to the resources they need for a healthy start to a long and successful life. From financing to construction to delivering the range of services that so many rely on MFHS to provide, projects like this are never as simple as you might expect. It takes a team that cares about our community and all of you. My PNC colleagues and I are proud to be part of this team and deliver our capabilities in ways that help our neighbors today, tomorrow, and beyond. Congratulations, Maria.
Thank you very much, Nicole. And it's my pleasure to invite up Dr. Maria Montoro Edwards, our president and CEO of MFHS, without who none of this would have happened. Her vision and leadership were inspirational. Maria.
I think I'm the shortest one to speak today. Thank you, Mike. This project is truly an example of a community coming together to meet a vital need for accessible healthcare. This collaboration has led to a new level of innovation for MFHS, which has been around for 50+ years. We're finding new and unique ways to meet our clients' needs, but of equal importance is the impact that this facility is going to have on the city of Scranton and Lackawanna County. In addition to the 30 retained professional positions, 15 new family-sustaining jobs have been created with the Circle of Care, now representing $3.6 million in total annual compensation. I'm grateful to our board of directors who had the vision and motivation to make this project a reality. Thank you to DX Dempsey for visually and structurally interpreting our vision. We are grateful to Seminaro Brothers, our general contractors, and our subcontractors who provided expert skill and craftsmanship and value. Thank you to our executive leadership team, Shannon Hayward, Chief Operations Officer, Dr. Julie Nardella, Chief Clinical Officer, Amy Roberts, Vice President for Human Resources, and Margaret Manley, our Chief Financial Officer. Thank you also to Posture for our branding and for pulling this wonderful presentation together today. And thank you to Molly and Jody and Jean for everything that you did to make this happen. The future of MFHS lies not only in our maternity medical home model, but also out in the parking lot. As you've probably seen, our new mobile WIC unit that is parked outside, and this will allow us to bring WIC services to the most rural of our communities. There are some places where our clients have to travel 20 to 30 minutes to get their services. So this will really help us to provide accessible nutrition services in the most rural places. We'll be partnering with schools, Head Starts, grocery stores to make sure that we can reach our clients where they are. Our goal is to continue to break down barriers to accessing health care across the 17 counties that we serve by replicating this maternity medical home model that you see here and bringing our services directly to the people that need us most through future innovations. Thank you once again to our financial supporters, especially thank you, Congressman Cartwright. Thank you for sharing our vision of the future of healthcare and for advocating for MFHS during the appropriations process. Your support has been the cornerstone of this project, and we are so grateful. A very special thank you to my husband, Kevin Edwards, and his business partner, Paul Strunk of Edwards Strunk, for their tireless efforts to secure a new market tax credit allocation and to facilitate the equity investment process, all on a pro bono basis. Thank you all for joining us today. Now, I would like to invite you to join us at the map of our service area for our official ribbon cutting. So I'd ask our board of trustees to please gather at the map and our executive team, and we'll do our ribbon cutting. And then afterwards, I guess we'll meet for the ribbon cutting first.